All right, so I'm going to do a pediatric assessment. First, I want to form a general impression of the baby. So you want to make sure it's good thermal regulation as you're performing the assessment. Try to do it as quickly and as thoroughly as possible so the patient isn't getting too cold. And so first, I'm just going to assess the heart rate. So you want to assess the point of maximal impulse. It should be between 110 and 160 for a newborn. And then next I'm going to do respirations. So with respirations, just want to listen for any abnormal lung sounds, and then also count the respirations. They should be between 30 and 60 for a newborn. And then as I'm looking at the baby, I would also want to assess skin integrity. So want to look for general skin stuff like lanugo on the newborn's head, any cafe au lait spots on the chest that you can see. You can also assess skin turgor, cap refill as well. So then next I'm going to measure the newborn. So I'm going to go from the heel to the head. Great, and then I'm going to measure the head at the highest point. You want to be careful with the newborn head, just because they can't support their weight yet. Gotcha. And then chest circumference. Great. So that's kind of the basics, and then now I'm going to go head to toe. So I'm going to start with the head. So I'm going to palpate the anterior fontanelle, and then you should feel the posterior fontanelle as well. And then you just want to kind of feel for any cephalehematomas, kaput, or anything like that. So this baby seems to be normal. Moving down to the eyes, I don't have a light with me, but you can assess retinal reflex on both eyes. And then also looking for symmetry of both eyes, and then their eyes should match up with the top of their ear on both sides as well. Moving down to their nose, you can assess their nares and the breathing pattern. Make sure there's no abnormalities there with nasal flaring or anything like that. To assess that, it's good if you assess the sucking reflex as well. So you can test your sucking reflex and then cover one nair and then the other, and then just kind of see if they're able to breathe with just one nair. Assess nasal patency as well. And then as you're doing that, you can also kind of palpate the upper and lower palate to make sure there's no abnormalities, and then obviously look for any outer abnormalities like cleft lip or anything like that. Moving on down, look at the neck, make sure the trachea is midline, looking for any birth trauma, nuchal cord, ecchymosis, anything like that. Clavicles, again, any birth trauma, any abnormalities from the birthing process should be evident in this assessment. Coming on down, you can measure the nipples as well. They should be measurable in a term baby. It's another assessment finding. As well, look for symmetry. So then moving on down to stomach, you want to assess all four quadrants. Great. And while you're down there, you can also look at the cord, make sure it's clamped. There's nothing coming out, no blood or pus or redness or swelling or anything like that. Make sure you can document the 3 cords or 3 vessels if there is any. And then also you can get a bilateral brachial pulse. Make sure they're equal. And then moving on down, you can also compare that to the femoral pulses as well. So then moving on to the genitalia. So this is a male. The testes have dropped, which is a clinical finding. You see rugae are visible, uncircumcised. You can check anal patency, and then make sure patient has voided or hasn't voided. You want to check for that and document accordingly. So now, just want to check the Ortolani and Barlow tests. So this is for hip dysplasia. So Ortolani is up here. If there's any crepitus or clicks, that should be noted and documented. And then Barlow is the extension of these legs. Good, so this baby is normal. Moving on down to lower extremities, you just want to look at baby's posture, make sure there's flexion and extension as well. And then also, you want to turn the baby. Just want to check the back, make sure the spine is even, symmetrical. If there's no open spots or anything like that with spina bifida, make sure the folds are equal on the lower extremities. That can also be a sign of hip dysplasia, and as well as the back of the neck. And then as you're back here, you also want to check the skin for any Mongolian spots, Kappa LA spots, stork bites, or anything like that. So moving on the feet and the hands, you want to make sure all the digits are intact. There's no webbing or anything like that. You can do the Babinski reflex test right here on each one, and then normal responses to fan out the digits, and then the palmar grasp for the upper extremities. And then you can also do the Moro reflex or drop test. So this is a gentle drop, and the baby should make a C with their hands. Another one is a stepping reflex. So once the baby touches the mat or something solid, they'll have like a simulated stepping reflex that should be noted. Lastly, we can get the weight, and that should be between 2,500 and 4,500 grams. And then, lastly, also, I want to kind of go back, but I would get the temperature, and that should be between 97.7 and 99.3, and that would be taken axillary. And then that's kind of a head to toe from top to bottom. Thanks.